I have hypoplastic left heart syndrome. Before I was 2, I had 4 open heart surgeries, and then my most recent open heart surgery was when I was 17.
Bryce has hypoplastic right heart syndrome. He has a total of 4 surgeries.
I was born with transposition of the great vessels and pulmonary stenosis. I've had 5 open heart surgeries.
Everything she has been through has been an unbelievable experience. I had been a nurse for 20 years in the ICUs. Being on the other end was a little bit different because it's your child. You know all the things that could happen, you're scared, and you just want your baby to be okay. I was giving meds and she was puking all the time. Her NG was coming out all the time. She didn't gain weight. I was scared all the time, and I had twins that were 2 at the time, and dealing with her and trying to give support to everybody else was far more difficult than I'd ever imagined.
It was heartbreaking, if I can say that. It was really heartbreaking to get that news, so ecstatic, and then just after that moment, your whole world changed.
Since I had a stroke at 17, it takes me a little bit to remember things.
He was in the hospital for 5 months, so he's behind. He needs occupational therapy. He needs speech therapy. I do have fears for the future. I think his journey is complex. We don't know how his journey is going to play out, and I think that's the scary part.
Since I'm a doctor who takes care of children with very complex heart disease, I see mortality more than most people in the medical field. The way that I choose to practice medicine for my patients is to be all in with the families, all in with the patients. And if you're going to do that, then the hard moments are going to hit you hard. And that's okay. It's reasonable after spending months to years with someone, knowing them from before the time they were born until those last moments, to be really hurt.
Some of the days that give me doubt are the reality of not having all the answers. Me as a nurse practitioner, it's hard. We look to our team, we look to our colleagues, and sometimes we don't have the answers. And that's what we have to tell families, we don't know. And goodness, that's hard. One thing in particular that sticks out to me that I am just in awe and surprised with every day is what true resilience does look like. I am grateful for that sacred space that families let us be in. They're open, they're vulnerable. That's hard to let new people in.
There are some really bad days, but what keeps me coming back for over a decade is that the good days far outweigh the bad. There's no doubt in my mind that I will keep doing this for a very long time. When you have a child in the hospital that is very sick, the parents are also in the hospital and their hearts are very sick as well. We are trying to focus more on the families and making sure that we really are giving family-centered care.
Many children with congenital heart disease don't look that sick. I don't know that the vast majority of people out there realize how common it is. It is the most common birth defect. One of the things that's really exciting about the congenital heart disease community right now is all of the partnerships that are happening between centers. But that kind of collaboration takes funding for the research assistance, for the database building, the infrastructure needed for these multiple centers to come together and share their collective knowledge so that everybody can benefit.
What needs to be addressed today is health equality. I think that we need to do a better job servicing the population of the people that we see.
We need to continue to address the gaps in our knowledge and our research and continue to fight for new and innovative approaches to care for some of our sickest patients.
With more research, with more fundraising, I'm seeing great changes in headway with outcomes, with teamwork, with all the things that go into caring for our patients with congenital heart disease.
My hopes for my future would be to graduate with my nursing degree.
I'm crossing my fingers that I'm gonna become a marriage and family therapist.
As I see him now, I mean, you can't help but think about how far he's come, how strong the little guy is, and you just have so much hope for the future, but you still know in the back of your head, every time you have a doctor's appointment or you get a call, there's still that fear that lingers on.